All right. Good morning, everyone, and welcome to the Local Health Policy RFP workshop. We really appreciate you taking the time to join us today. Just a couple of housekeeping items. If you do need closed captioning, that function is enabled, and so you can turn that on at the bottom of your screen so that you can get the text at the bottom, but you just have to enable that on your end. And then this webinar will be posted to our website along with the slides. If you need to go back and reference anything, those will all be available on the website. With that, I'm going to share my screen and we will get started. All right, so during our time together, we're gonna chat a little bit, just a quick overview about Interact for Health, dig into the local health policy RFP, talk about the application process, and then we'll have plenty of time at the end for any questions that folks have. So I'm going to take a minute to introduce our Advancing Health Justice team. I would love for you all to share your name and organization in the chat so that we know who all is joining us today. This is our team. My name is Megan Folkerth. I'm Senior Director for Health Policy and Systems, so I lead our local health policy work here at Interact for Health. And you can see on the screen the rest of my team members. We have Kelly Adcock, our Senior Director of Data and Learning, Caitlin Bentley Thayer, our Senior Program Manager of Community Engagement for our rural communities, Sonia Carrico, Program Director for Mental Health Policy, Julian Collins, Senior Program Manager of Community Engagement for our urban and suburban communities, Colleen Desmond, Senior Manager for Data and Learning, and Ashley Young, our Vice President of Policy Engagement. So this group makes up our Advancing Health Justice team focused on our community power building work as well as our policy and systems change efforts. So a little bit about Interact for Health. Here at Interact for Health, we envision a healthier and more just future. We work so that people in our region are healthy and thriving, regardless of who they are or where they live. And we're focused on advancing health justice by tackling those root causes of unfair systems, amplifying community power, and partnering with trust. We developed a new set of values when we launched this strategic plan, and these really we're rooted in these, and these guide our work internally and externally. As a team, we're very committed to these values. A couple that really stick out and resonate with me are amplifying community power. We'll talk about that some today, but really ensuring that those closest to the issue are closest to the solution and they are driving the process. Also, that we partner with trust. I think we have made a lot of progress in this area as an organization, really building relationship with our partners and embedding those principles into our grant making as well as how we work alongside community. So this map shows the footprint of our organization. We serve a 20-county region across 3 states, Ohio, Kentucky, and Indiana, and this makes up about 2.4 million people. So the funding for this project has to focus in at least one of these communities. Now, within those communities, we focus our work on specific priority populations, those that are facing the greatest barriers to health and well-being. So our work is rooted in supporting Black communities, Hispanic communities, children in families with low incomes, our rural communities, and the LGBTQ+ community. And so while we certainly understand that, especially in the policy and systems change work, those policies that we're working on will impact the whole of the community and should impact all people. However, we want to make sure that we are really focusing in on the populations that are facing the greatest barriers and that they are part of the process and that we are centering them in the work. This shows our strategic framework for our current strategic plan, which is from 2023 to 2027. So we are about halfway into this strategic plan. The work we are going to talk about today focuses on our policy and systems change efforts, really focused on advancing policies that address community conditions, strengthening that greater advocacy ecosystem, and then mental health policy. But then we also have 2 other Focus areas are community power work, which is community-led solutions in place and where our rural work falls, and then mental health and well-being, advancing regional collaboration in this area through the HAY, as well as catalyzing safe and supportive spaces for youth through home, community, and school. So in order to do this work, while we certainly are a grant maker, we work to provide flexible funding, but we also have other areas in which we use our voice and work in the region. We convene partners, we work to amplify community voice. We are a go-to resource for data on health and health justice, and we are a trusted nonpartisan voice for change. So, digging into the local health policy RFP and why you're all here today to learn about this funding opportunity. When we think about the health of our community, we really need to focus on the health of the whole person. The World Health Organization says that health is a state of complete physical, mental, and social well-being, not just merely the absence of disease. And that really highlights why we're here and what this work is meant to do. So as you can see here, this graphic shows the vital conditions framework. This is adapted from the Ripple Foundation. And what you see is on the left-hand side, the vital conditions for health and well-being, and on the right-hand side, urgent services. And the vital conditions framework really allows us to shift the way we think about the health and well-being of our community and recognize that while there is a time and a place and urgent services are always going to be needed, we have gotten to a place where we tend to have an over-reliance on urgent services and we're out of balance. And no matter how much we put into these urgent services, those are never going to address the conditions of the community that we need for all people to thrive. So the vital conditions for health and well-being, which you will see on the left-hand side, are the conditions in which people are born, grow, work, live, and age, and the wider set of forces that shape our daily lives. So these are what are needed for people and communities to reach their full potential and to create an equitable and thriving future for ourselves and for generations to come. And you can see at the center of that circle is belonging and civic muscle. And so when we think about this RFP and the focus of this work, we're really building that civic muscle and leaning into advocacy and policy, democracy, and having an impact on these vital conditions for health and well-being. So digging a little bit more just into the left side, since that's the focus of this RFP, things that could fall into this, policies that hit these areas, thinking about thriving natural world, sustainable resources, clean air, clean water, clean soil, basic needs for health and safety, nutritious food, physical activity, communities that are safe and free from violence and crime, humane housing. So not only safe housing, but affordable housing. We want to have diverse neighborhoods that are close to work, school, food, recreation, meaningful work and wealth. We know that people need good, paying, and fulfilling jobs, lifelong learning, so from early childhood all the way through higher education, reliable transportation that is safe and accessible and can get people to where they need to go for work, school, food, and to enjoy their lives. And then that belonging and civic muscle, again, being part of something bigger, having that power to shape the common world, and really leaning into our community. We really see this as a vital piece. It's really at the center because it allows people to use their voice and work for equitable success for everyone. So with that, this RFP is designed around addressing those vital conditions for health and well-being to advance local policy and advocacy efforts focused on addressing the social, economic, and environmental factors that shape health. So for the policy and advocacy work, we oftentimes think about the policy passing as the most important piece. And while it is certainly important, we are interested in supporting the full policy and advocacy continuum, all the way from agenda setting to policy and valuation. So through the application process, we ask organizations to share their plans and strategies for local level policy and advocacy efforts to address those vital conditions. They can focus on all phases of the policy process, and however, and while the policy win isn't necessarily what we're going for, we do want to make sure that we are moving beyond that coalition building, education, community education, and moving towards working on policy adoption. We certainly understand that every project is not going to get a policy win, and that is okay. But we need to ensure that we're moving through the policy phases and not just staying in talking about the work, but really advancing through the process. Applications can focus at the local jurisdiction level or through governing and administrative boards. Things like zoning boards and school boards would also qualify for this local policy RFP. So a variety of activities can fall into that. Why we have those policy phases, starting from agenda setting, policy development, getting the policy passed, maintaining the policy through implementation and enforcement. There's a lot of activities that fall within those phases. So we have things such as grassroots mobilization, conducting advocacy to increase awareness or build political will to act. There's legislative education for our policy makers in these key policy areas. Coalition building for advocates is certainly an important component of the process. Direct policy advocacy, things like providing testimony at city council or at the zoning board, sharing model policies or model policy language with elected officials, conducting public education, media campaigns, policy position statements that are used to educate the public. All of these types of activities would fall into this RFP. Now, this list is certainly not exhaustive. We just wanted to give a flavor of what some of the policy areas could be that fall into that vital conditions framework. So I think housing is a big topic in our region right now, and we're seeing lots of momentum in this area. Things around affordable housing trust, legal support for renters, tenant rights, same-day legal representation, things like that. Paid sick leave, childcare access, healthy rental housing, smoke-free indoor air policies, menthol and flavored tobacco restrictions, which depending on your jurisdiction, you may or may not be able to do this right now based on state law. Certainly happy to discuss further if that one applies to you. But these are just some of the policy examples I think that we've, seen gaining momentum in our region or that we know fall into these areas that we wanted to highlight. But we are certainly open to other policy areas as long as they fit into those vital conditions. So the nitty-gritty funding details for the RFP, the total amount available this year is $700,000. These grants will be awarded as general operating support, so that gives some flexibility as far as supporting the overall organization for their policy and advocacy efforts. We anticipate that the grants will be 18 to 36 months. Policy work takes a long time. If anyone applied for less than 18 months, I think we'd probably push back a little bit and say it's not long enough. I would venture to guess most will probably be 2-year grants. And then those are reversed. It should say anticipated length and then amount switch. So I apologize for that. We will correct it before it goes on the website. But the amount will vary based on the length of the grant. So if it was on the shorter side, we'd anticipate closer to 75,000. The larger grants could be up to 250,000. I will say though that we want you to ask for what you need. Again, we have $700,000 available. We're not going to be able to award that all to one organization. So ask for what you need, but know that, we might not be able to fulfill that, but we do want to understand what your needs are, what it would take to get this work done. We don't want you to, necessarily cram yourselves into these parameters if it doesn't make sense for you. Please ask questions, have a conversation with us if you're trying to narrow in and figure that out. This is the same map you saw earlier, but the eligibility criteria, you must provide services in at least one county in our Interact for Health 20 county service area that you see here, and also be a public or private, nonprofit, or governmental organization. There is also the opportunity for fiscal sponsorship. So if you are not a nonprofit or government entity and you work through a fiscal sponsorship with another organization, that certainly applies. If you're not sure what that means and you need to talk about it, we can talk you through that process, provide some information for you, but we are able to award through fiscal sponsorship if needed. Typically, that'll apply if there's a community coalition that doesn't have their nonprofit status and is working with another partner. That would be an example. Once the proposals are in and we're looking at the proposal selection criteria, as I talked about, we really have an intentional focus on our priority communities that you see listed here. And so while the policy work will apply to the full community, we do want to make sure that these priority communities, audiences are highlighted in the work and are at the center of the work. So this will fall into that criteria when we are evaluating applications. Also, it is important for us, like I said at the beginning, people that are closest to the problem are closest to the solution, and we want people to be authentically centered in the work. So those people in communities that are most impacted by the topic, the policy area that you are working on should be involved in the work, especially through leadership decision-making, not just informed of what's happening, but really having a voice in the process and the decisions that are being made for their community. All of the work should focus on improving health outcomes by reducing disparities and advancing health justice. Other things such as, having goals for the grant period that are clear, feasible, aligned with the goal of the RFP. Certainly, we understand that you can't tackle everything, and we wouldn't expect someone to come in and say, we're going to pass 5 policies in 18 months. So right size the work for what you think can be accomplished. Demonstrate that the organization can achieve the goals with the budget timeline and the staff capacity that you have. Again, policy and advocacy work, a lot of it really is about staffing and about having people that can do the work. And I would also note, as you are engaging community and they are part of the process, we would be fully supportive of paying those community members. We all get paid to show up and do our jobs. And if community are leading and being part of this process, certainly paying them for their time is important. And then a focus on a specific and identified local level policy and advocacy effort that the community has prioritized that focuses on these vital conditions for health and well-being. And so when I say something already identified, we want to know what you're working towards. We don't just, we're not looking for, we need to address housing in our community. What specifically are you thinking of? Are you thinking of changing zoning laws? Are you focused on the tenant side of things with rental housing? What is the specific area that you want to focus on rather than a very broad topic that, you haven't necessarily identified or narrowed in? Certainly, as you move through the process and move through the work, things might pop up that are new or different that you integrate into the work, but we do want to get an understanding of what specific policy area you are driving after. So for the application process, all of this information can be found on our website if you go to interactforhealth.org/open-funding. And when these slides are up, you will be able to click that link to get through. But on this page of our website, you will see you can access the grants portal through that green button on the bottom left that you see, and that'll take you to where you actually apply. There is also an applicant tutorial page that you can click on, and that'll give you step-by-step guides of walking through that online portal. And then certainly if you have any questions, our grants manager, Christine Schultz, is available to answer questions. I'm also available to answer questions. We don't want the online portal to be a barrier to anyone. So certainly reach out as you are going through that process. But when you access the grants portal, If you already have a login because you've worked with us before, you would just log into your account and then you would see the open RFP that you could apply for. If you've never applied with us, you will have to create an account in the system, put your information, your organizational information in there, and then you will be able to begin the application process. The other thing I will say is that you can go in, you can start an application. As long as you save along the way, you can go back and edit all the way up until you decide to submit the application. They're also on the open RFP page where you'll find the RFP. You'll also find the application questions. So if you want to look at those questions before going into the portal, you can do that. There should be a PDF as well as a Word file where you can see all the application questions. That way, if you wanted to have a conversation with other folks at your organization or work on some of those things, I know some people prefer to work outside of the online system, collaboratively with partners, maybe through Google Doc or something like that. They like to do that and then copy and paste. The only thing I will say to be mindful of is the character limits for the questions. We certainly want detail about what you're doing, but we're trying to ease the burden. So we don't want you to have to provide a crazy amount of information to us, but just be mindful of the character limits if you are working outside of the system, because when you go to paste things in, it won't let you save it if it's over that limit. The timeline, we're having the webinar today. The proposal deadline is on Friday, April 4th at 5 p.m. And then we will conduct site visits once the RFP is submitted, and those will occur between Monday, April 21st and Friday, May 2nd. In the application, you'll see kind of an open-ended box where you can supply 3 times during those 2 weeks that work for you and the members of your team that you would want to be at the site visit. And as soon as we make decisions on site visits, we will notify you and work with you to still make sure that time works. And then we will be notifying grantees of their award no later than Friday, May 9th. So for the site visits, again, those will be between April 21st and May 2nd. We typically like to book about an hour and a half for those. A lot of times they only take an hour, but I'd rather have a little bit of extra time if needed. And this is really just a time for us to get to know you more and discuss the project a little bit more. The application is great. It gives us a lot of information. However, a lot can come to life in a meeting when we're face to face with one another and really bring the work to life. So general conversation about the proposed project, talking about those populations, what community engagement tactics you're going to use, any collaborating partners or organizations, and then also a conversation around your organization's journey around diversity, equity, and inclusion, and specifically how your organization is representative of the community you're working in, and how you've worked in those communities. So I am going to stop sharing my screen so we can all see one another. And we have plenty of time for questions. We can, I know, thank you to my colleagues that have been answering questions in the chat as we go. But feel free to unmute yourself and ask a question, or you can place it in the chat, but happy to have a conversation here with anyone that has questions.
We do have a question in chat that we didn't, oh, Caroline just wrote it there, but it might be a great one just to say out loud. Are state level policy and advocacy efforts that affect counties in the RFP eligible?
Yeah, this work is really focused on local policy change. We certainly know that state policy is important and has an impact on us locally. All of our state policy efforts are focused, not all of them, I should say, but our primary focus at the state level is on our mental health and well-being, and through some of our partnerships there. But this RFP is really focused on making those local level policy changes. We could certainly open to a conversation, Mary, about our state policy work and chatting more in depth, but this would probably not be the best avenue for that. Was there any other questions in the chat that you think would be helpful to share with anyone? And a local policy be around data collection. Data collection certainly can be part of that. Marcia, would you mind coming off mute and explaining a little bit more? Do you have the capability to do that? I can't hear you, Ashley. You're muted. Oh, we need to change the settings.
Okay, try again.
Okay.
She
you hear
can
me?
talk now. Yeah.
So I'm just wondering, like at a local level, like a focus of ours is really on data collection here at the health department. And so could this funding be part of like if that's a policy that we change internally? Is that not, I mean, I know we're looking at the broader community, but internal, is that acceptable?
Internal to the health department?
Yeah, I mean, it would be shared out with the community and like partners, but
Probably not. I'm certainly happy to have a little bit more in-depth conversation, but if the data collection was informing specific policy changes, like if you were working on a housing policy and you were collecting community data to gain support to inform those policy decisions, that certainly could apply, but it would have to be directly related to a policy effort, not just a data collection strategy.
gotcha. I mean, we got lots of strategies, but yeah, that was just so thank you. Thank you.
Yeah, absolutely. And always happy to chat more. Any other questions? Let's see, Gina. Can a local policy issue be related to workforce issues that affect health service delivery? Do you mind jumping off and sharing a little bit more?
Yeah, can you hear me okay?
Thanks.
Okay, great. I know a lot of the nonprofits here, a lot of their employees, they're having retention issues, I'll say, attraction issues due to low pay, which affects the ability to serve their clients adequately. So I wondered if that's a type of issue that would, come under the umbrella of what you're looking for here.
Would it be at a jurisdiction level or would it be organization specific?
It would be a coalition, I'll say, of organizations.
Okay, so I think what we're really looking for here is jurisdiction level policy. Like I said, for zoning boards, school boards, city councils, those types of entities versus necessarily something that's impacting organization specific policy, which I think a coalition would still, while it would be a group of organizations, it would probably still be organizational policy.
Oh, no, this would be like, I guess, trying to find funding sources to help with workplace employee funding levels.
Okay. My initial gut is that it's probably not super aligned, but we could certainly chat more. Ashley, I don't know if you have any thoughts based on like the workforce conversations that Sonia's having as well.
Yeah, I would say let's probably talk offline about it. Let's get a meeting scheduled.
Yeah, and
That sounds good.
maybe bring Sonia in too, given her focus on workforce.
Mm-hmm.
Thank you.
And I know some people have to hop off. I'm happy to stay on if people have more questions or want to chat further. I also will reiterate, we have our community information sessions coming up. I'm going to share those again, real quick here, where program staff will be available to answer any questions about the RFP. So we have an in-person one here at our office on Wednesday, March 12th from 1 to 3. No need to register, no need to show up right at 1, show up at any point during that time frame. We'll have coffee and snacks and can chat about the RFP, chat about any ideas you have, questions you have. And then there will also be a virtual one on Monday, March 17th from 9:30 to 11:30. There is a link to register there. If you register and you can't join, that's okay. We just need people to be able to register so we can share a link with you to join, but that'll just be a virtual session. Again, join at any time within that window, and we're here to answer questions. And looks like Danielle has a question. Feel free to come off mute and ask your question. Danielle? And I see Carmen, you want the slide that shows what policy change efforts are funded. I will pull that back up real quick for you. Is this the slide you're referring to, Carmen?
Sorry, I think it was one just a little bit further down. I'm not actually sure what the title was. I'm obviously in 2 meetings at once. I'm so sorry.
Oh, you're fine. There's activities, the policy phases.
I think it was the activities. That's what I wanted. Thank you.
There you go. You're welcome. We'll leave that there and feel free to call or join one of the information sessions. Send me an email. We're always happy. We'd rather have a conversation early. We don't want to waste anyone's time if it's not aligned. Well, it's disappointing. We'd rather not have you spend your time applying if we can have that conversation ahead of time, or if we can, have a conversation that allows us to narrow in a little bit to something that is more aligned. So always feel free to reach out with questions, with information. I will put my contact information back up. If you have questions, feel free to email or call, and then again, join one of those information sessions. Our services operate in multiple counties throughout Ohio with overlap in the 20 county service area. Looking for policy change at a city or county level. It could be either one of those, Chelsea. I think it depends on the policy and who has the authority to make that policy change too. But it certainly could be a city level or a county level. We would be open to either one of those. And I will stop share. Again, I'm happy to stick around for a few minutes if people have more questions. If not, we appreciate you all joining today. We're grateful you took time out of your busy schedules to learn a little bit more. We look forward to having continued conversations over the next month in the applications. And again, reach out with any questions.